All right, maybe we can get started. Welcome everyone. Welcome to the information session on the Applied Data Science Bootcamp by the MIT IDSS faculty. In fact, we have one of the faculty from MIT IDSS right here with us. This session is going to be about the first half is where Professor Munther Dahleh, he goes by Munther, will be talking about some research work that they are doing using these very data science techniques that you'll be learning at the boot camp. I'll introduce Professor Munther in a bit. And the second half of the session is going to be where we'll have a Q&A about this Applied Data Science Bootcamp, where Professor Munther and other faculty will be teaching these very techniques that you will learn soon. But before that, I would like to introduce Professor Munther Dahleh. He goes by Munther, and so I'll probably take the liberty of referring to him as that, because that's how I know him. Munther, he's extremely accomplished, and just thought I'll put a short introduction here. He's the director of the MIT Institute for Data Systems and Society, which I think Professor Munther will talk about a bit more about the great work that they are doing. Also because that's the institute from where the faculty who are applying data science across a wide variety of industries and use cases will be teaching this boot camp. Munther is also the professor at the ECS department at MIT. He is, of course, the recipient of numerous awards. I was trying to list it out, but then I realized I won't be able to fit it on one slide. So I just made a short bullet point about it. But what I really find interesting, and I was mentioning to Munther just a little while back, is although he's an ECS professor, he has done research where he's applied these data science techniques, across a wide, in just about every industry. If you are in a certain industry, very likely he has done some work there. Biomedical engineering, transportation, social sciences, network sciences, healthcare, economics. You just name it. He seems to have figured out how to have impact with one common, denominator, which is data science and machine learning, and how to apply it across all these industries. With that, let me hand it over to the man himself, to Munther, because the way we have structured this talk is the first half of the talk is going to be where Munther is going to be talking about how these very data science techniques, these statistical methods that you'll be learning in the boot camp are being used by him and his team to fight COVID, right? And in fact, they're also helping entire states and the NIH figure this out. So we'd love to know, how he's applying it, not just talking the talk, but actually applying these very techniques to solve real world problems. And then we'll move it on to a Q&A. And by the way, feel free to ask your questions, because the idea is how we all can learn from this and apply these very techniques, through the program such as the boot camp to problems that we are seeing in our industry. Yeah. So with that, let me just hand it over to Professor Munther Dahleh. Munther, welcome, and thanks again for taking the time to give us this talk.
Okay, thank you so much, Milind, for the nice introduction, and welcome all of you to this webinar. As Milind said, I want to give you an overview of a couple of things, actually. One is what data science and information systems can do for you, and the breadth of applications that you can have. Why it's important to understand these things at a more detailed level than the superficial way of just, I want to apply this particular technique. And then I want to give you an example with COVID-19, and sort of give you a perspective of the bootcamp in specific as you ask questions and so forth. So let me share my screen. Feel free to drop questions in the chat, and I think Milind can interrupt me anytime with a particular question that is relevant. So the title is about COVID-19. I want to say that actually some of the detailed research that I'm presenting here, I'm not going to present a lot of detailed research. It will take us a lot more than half an hour to do this. is a collective effort. And this is something that IDSS, the Institute for Data Systems and Society, launched early April. It's a collaborative effort. It was actually phenomenal. I want to say a few words about that. It was an open forum where we met every day at 5 p.m. Eastern Daytime. But the meeting was open for anyone in the world. Anyone can actually join us. And 4 of us, 4 faculty, were there all the time. One of them, Dahleh, will be also teaching in this boot camp. We had postdocs, students, researchers, and as I said, people from all around the world. And we started by saying, how can we be helpful? I mean, we are data scientists. Maybe, we know something about, tools for understanding data. How can we be helpful? We didn't even know who we were going to be helpful to, because we were not charged to do something specific, right? And so, well, the first thing that came to mind is that, well, we cannot be helpful without collecting all the data sets that we can put our hands on. So we started by creating a data environment that brought in a lot of data sets on COVID-19, and there wasn't much at that time. We were building up the data set as we go. And a lot of people, and you hear it on the news, I always refer to it as the CNN story, but the data is not good, the data is noisy, we cannot do anything with the data. And my response to these people is that data is information. Any amount of data is better than not having the data. Now, if you do the analysis right, you can tell me something, but you can also tell me how certain you are about your recommendation. So that's the important thing about data science. It's not so much that I need a crisp answer, go right or go left, but rather, if you go right, you are correct with 60% chance. That's a very valuable piece of information to a decision maker. So uncertainty quantification goes hand in hand with learning models and learning information about data. So we proceeded with that attitude in terms of the data. Data is noisy, we don't care. We will tell you how well the data can give you answers and so forth. So credit goes to all of these people that I'm mentioning over here. Our website that is listed over there, you can click on it, and there's just a ton of information there for you to kind of chew on. Hopefully, and by the end of the boot camp, a lot of the mathematical tools and the methodologies used are going to become second nature to you. Let me say a few things about pandemics and kind of a general thing. And this is partially also to give you a perspective of what IDSS is all about, because this is an institute that is 6 years old. I am the founding director. We spend a lot of time at MIT trying to understand to what extent these tools of data science and are important, and why are they important. So I want to give you a little bit of background that way. See, if you think about the Spanish flu, we have employed the same techniques that we are employing with the COVID-19. Before you get a vaccine, it's really interesting. There aren't that many things you can do other than locking down and social distancing to prevent the contagion from happening. And so we kind of of course, a vaccine is a wonderful thing to have, and there is no substitute for governments and organizations to have laid out a systematic way of getting to a vaccine as quickly as possible. I'm not going to talk about that, but that is a job that every country should have in place. But there will always be a delay, and these pandemics can be quite potent. One of the interesting things about COVID-19 is that it's asymptomatic with a lot of people. And so as a result, the people that are infecting others may be hidden without being, if it's symptomatic in general, it's actually easier because people self-quarantine. When you're sick, you go home. You don't go around and infect other people. So it's the asymptomatic aspect of this virus that actually created this sort of scare and this kind of particular pandemic. So what can happen in such a pandemic? I want to give you a perspective of the breadth of the issue about a pandemic, but I thought I'll take you back to 2008. I hope many of you are old enough to remember what happened in 2008 financial crisis. I am old enough to tell you that it was a very scary time, but there are some interesting observations about that. So the reason we had the failure of the financial system at that time is because of the subprime mortgage market, the mortgage market that was fragile at that time. But here's a piece of information for some of you that don't know. The subprime mortgage market around the world was about 5% of the total financial market. 5%. So 5% failure resulted in the failure of the global market. This is incredible, right? How could 5% bring down the whole institution? Well, it's very simple. It's this property called contagion. We refer to it in financial systems as systemic risk, cascaded failures. The problem is not that 5% occurred in an isolated way. This 5% was scattered in the financial system that is heavily interconnected. Financial institutions are heavily interconnected. It's no longer that the bank in the neighborhood only services the people in that neighborhood. Banks are connected, financial institutions are connected. And by the way, another topic for another day, they are connected in a lot of different ways. So the banks could be interconnected because of the credit and liability they have between them. They can be connected because they invest in certain portfolios. They can be connected because their risk metrics are similar. These different networks all are in play to cause the contagion of this failure. And in some sense, I would say that I work a lot in systemic risk and robustness of financial systems, transportation systems, and so forth. And I would say that the only way you can actually monitor and mitigate these types of systems is to have real-time data collected on all of these interactions. Something that I would say we haven't accomplished, and I don't think, for example, today, a financial collapse is inevitable because, I don't think it's avoidable because we are not more sophisticated than we were in 2008. Okay, so different topic, but it's a very nice parallel. So to talk about COVID-19 and the contagion of COVID-19, I want to give you a perspective of the magnitude of this problem. So this slide just says the obvious thing that the reason we have a lot of cases, a lot of deaths. It's unfortunate. The virus, from a biological point of view, has a large incubation period, and it does cause a different type of effect in different people. So it is either asymptomatic into potentially deadly. The spectrum is very high, and interestingly enough, from an evolutionary point of view, it's actually asymptomatic with the younger generation. At the time when we were doing the research for COVID-19, and I will tell you, anecdotally, part of what happened is, a lot of us were so impacted by the lockdown, that we couldn't do our regular work. It's like I couldn't do my regular research. The only thing I could focus on was COVID-19. And so when we formed this ISOLAD, this COVID-19 collaboration platform, that's all I did. I was reading about the problem. I was connecting with epidemiologists. I was trying to understand the models that existed out there. I left everything aside and I just focused on this particular problem. But at that time, when we were looking, there was limited PCR testing. Now we have a lot more PCR testing, which is great, because it's very important. Antibody testing remains somewhat questionable in COVID-19. Somehow didn't have enough penetration, at least in the United States. The error factor is still substantial. And the important thing that all of us wanted to do is to manage this crisis. And I want to tell you a little bit more about managing this crisis. But here is another aspect of this, another dimension that I wanted to talk about, which unifies these societal challenges, whether it's the financial risk, whether it is congestion problems, whether it's pandemics, whether it's voting, whether it's the power grid and cybersecurity in that domain. There's this unifying complexity that we at IDSS have identified in this simple triangle, okay? And we think of a lot of these problems as the interaction of three different heterogeneous components. One component is the physical, biological aspect of the problem. In the COVID-19 case, it's the property of the virus, the propagation of the virus, its weight, its size, whether it's actually airborne or it needs certain molecules to live in. This is all chemistry and biology, right? Another, which we need to understand, clearly that piece had to be understood. The other piece is the social behavior. How do people interact with each other? And what is our aptitude to take on lockdowns and restrictions? It's one of the biggest problems that I was, because I have collaborations in Brazil, is that even when the country instituted the lockdowns, people were still socializing. People were still seeing each other and hanging out, but in hiding. And it's very difficult to police people's behavior. In fact, you don't want to do that. So what you have to do is to create incentives for them to behave in a certain way. This incentive design problem in economics called mechanisms, it's very interesting, and it has to be tracked through data about social behavior. A third piece is the institution. Institutions, by that I mean the healthcare system, the economic forum, the leadership of a country, the stakeholders that are rolling out policies and so forth. Those are the ones that design the policy that is implementable at multiple levels, right? Policy could be a testing policy, or it could be a lockdown policy, could be a mask policy, you name it. So in order to figure out how to mitigate a problem like the pandemic, and you can take the story and map it to the financial system, and it will map one-in-one, actually, you need the data. You need the data about the virus. You need the data about social interaction. You need the data about policy. You need the data to understand what's going on. The problem in understanding data, and why in-depth understanding of data is important, is that this data set is heterogeneous. It's very different in one sector versus the other. When you look at the social interaction, you're looking at counties, affluent county, poorer county, vulnerable communities, people that go to work and have to be at work versus the people that can work from home. That's the data on people. Data on institutions and how decisions are being made, and the decisions that are being made look like very broad, high-level decisions, lockdown, for example, or wearing a mask and so forth. And of course, the data about the contagion of the virus is very biological and dynamic. Different data sets, right? And so you sit down and you want to think about the breadth of this problem, and that's what we did in this collaboration. So we started looking into what data sets exist and what we can collect. So right away we started collecting data on infection, and I'm going to make a few interesting points about that. When back in April, when people talked about infection, this data was very noisy, and asked the question, what can I do with it? I'm going to come back to that point. But we also had to collect data about hospitalization and healthcare. We needed to collect that data about economic impact. And when I say about economic impact, well, every one of you probably thought of something. Well, some people looked at the stock market. How's the stock market behaving? Some people looked at, manufacturing, packaging, supply chain. Some people are looking at what happened to the poor community and the vulnerable communities and so forth, right? You gotta collect data at multiple levels of economics, right? Why is that important? I'll tell you why that is important in a second, okay? What are the levers we have? As I said, well, the first thing is a vaccine, which we don't have. If we had a vaccine, I would say the first thing we need to do, take the vaccine and start vaccinating people right and left, going from the vulnerable communities and propagating into everybody else. But we don't have that. So we employ different strategies, and these strategies are effective. Some of them go as far as the Spanish flu, but some are new, okay? And I will tell you the new things that we can do. So the lockdown can be in terms of mobility, social distancing, of course, the wearing of the masks. But the question that always was there is, by how much? How much lockdown is necessary to contain this particular disease? That's an interesting question. Come back to that. Second lever is test, quarantine, and trace, contact trace. Now, I want to emphasize to this particular group, it's very important to recognize that testing is not just about observing the state of infection. Testing is a control strategy. If you think about it, a notion of reproduction rate, R naught, that people talk about all the time, is essentially the number of people that an infected person will infect in their lifetime, in the time of their sickness. So if this reproduction factor is greater than 1, then this disease is actually expanding very rapidly. So what does testing, quarantining, and tracing does? Well, if you test frequently enough and take the people who are infected out of the system by quarantining them, as well as contact trace and take the people who are also testing positive and taking them out, you reduce the R naught to a quantity less than 1 if you do it at the right rate. So you are actually stabilizing the dynamics of infection, a very important component. But what data do you have to tell you how fast should you be testing? How do you measure that data? How do you estimate that data? That's part of the data science exercise. And finally, the economic decisions. I think it's really important to recognize that, what happened, and one of the failures I think that happened in a lot of countries is the disconnection between healthcare people and economic decision makers, and of course politicians for that matter. The healthcare people are entirely incentivized to prevent number of deaths. So from their perspective, if they ran the countries, they would say lockdown until we figure out the vaccine and then we open up. The economics people have this idea that, well, if you go into an economic crash, then it will take multiple years to come out. And so the question is, how do we trade off these things? And it's been a continuous battle between different types of people. So I want to say that, of course, it's a good trade-off, and it's an interesting trade-off. But it's one kind of a trade-off where, unless countries are working in collaborations, it doesn't work very well. So I'll give you an example. Sweden has made a decision not to go into a severe lockdown. So they did a minor lockdown. Sweden healthcare system is pretty good. And so their argument was, we don't have to lock down the country because we can actually absorb a lot of sick people into our hospitals. And that was a pretty good argument. They initially had more deaths than the rest of Europe, but it's just a question of when the deaths occurred. Over time, I think they controlled the infection, and they kept the economy running. They kept the educational system running. But as you know, the analysis of looking at the aggregate economic benefits for Sweden, it turns out that they didn't gain that much. And part of the reason, of course, and we can get into that as a separate argument, is that Sweden didn't exist independently of the rest of Europe, and Europe did not employ the same strategies. So as an isolated country, economics makes very little sense to you. You really have to work with neighboring countries. So economics, one aspect is collaboration with different countries. So you need the data from different countries. As I said, you need to look at data on vulnerable communities. I talk about vulnerable communities a lot, and I've been doing some research now in the past 4 months on this group, because of a very important aspect to this group. And we're doing some analysis. Hopefully we're gonna get a paper sometime soon. So you look at something interesting that happened. In the case when there was no lockdown, a lot of people were dying in those communities because, one, they had bad healthcare system. Two, a lot of them lived in high density areas, so the number of people per room were high, so the contagion were high. Actually, there were multiple generations living in the same household, and so forth. There was a lot of different reasons why they were in that situation. Okay, when the lockdown occurred, and these people couldn't go to work, which is really important because many of them do not have sophisticated jobs where they can work on a computer. They also had the stress of not being able to feed the family, and the number of deaths also increased. So with the lockdown, they were dying. Without the lockdown, they were dying. And I think that that's part of an interesting economic policy that would have to infuse funding into these kind of communities. But from data, you have to recognize them. From data, you have to understand how much you should support them, and so forth. All of this depends on the information and data that you have. Okay, so as you can see, this problem isn't Go ahead.
Sorry to interrupt, but as you were explaining about this data, and I also like the examples you gave, of Sweden and Brazil, and of course the US. There's an interesting linkage here on. It's not just there are these a whole bunch of interconnected systems and the social problems. And as people were hearing it, I guess a lot of people are getting inspired on this. But you're pointed on data, so folks like Nicholas are asking, well. We'd like to do something similar. So where is this data? Which countries have the most patient data available on COVID infections that we can, start using? Maybe they can also start using that for their projects. Any feedback there, Professor, on where they could get this data that you're mentioning?
So I think it's a great question. So John Hopkins, of course, as a health institution, right? I mean, as a university, but they are one of the largest hospitals, published the best infection data of the United States. And so if you're looking for infections, actually testing and symptomatic, as well as death in the United States, I would say the John Hopkins data is the best data you have there. New York has actually published data that is on our website that you can access to of how was going on in New York City. The economics data was never even linked to the COVID-19 data until recently. And right now, we're actually looking into, for example, the New York data, again, I would say it's one of the best data we have. That is, it takes county by county, looks at the income, density in lifestyle, death by COVID-19, death by other stresses that are not related to COVID-19, in an incremental way above the usual death. So you see what has been the effect of either a policy of some sort. So that's a good question. And as I said, we try to keep our access data sets on isolate current. So there's information there.
No, I love that. And I'll also make a quick plug here. The professors have also been kind enough to compile a lot of this data that the professor is talking about, right? Like, especially like you mentioned, the economics data. Who would have thought that there's a linkage there? But it turns out it's such an interconnected system. There is a linkage, and that's where the insights can come from. What I do want to make a plug for here, by the way, is the professors have been kind enough to also share this data. On the IDSS website, you can find that they've compiled a lot of this COVID-related data, and that's also what for our students for the bootcamp. We'll also be making available, so that if any of you choose to pursue further on build on these insights that the professor is talking about, and maybe get some more insights, absolutely you can dig deeper into this data that the team at IDSS have compiled together. So just an FYI for anyone who's interested in further pursuing research in this field through the bootcamp.
Okay, good. I know that we're almost at the half point. I have a couple of things I want to say, and then I can stop, Milind. So, but let me know when we're ready for the questions and answers. So the one area where I wanted to emphasize to you as prospective students for this kind of bootcamp is this whole idea of noisy data. I think it's really critical that, people understand that, again, as I said before, data is always noisy. Data is never perfect. If it was perfect, then then our jobs will be done. That is our job, is to process noisy data. So I give you an example, and then and this will be very, very interesting sort of illustration of what goes on. So let me describe the example for a second over here. So this, can you see my cursor, by the way, as I'm moving it?
Yes.
Okay. So this on the left here, I am plotting a sort of a number of infected people, okay, as a function of time. And I'm plotting a situation where the pandemic is under control. So what happens is that initially things grow, and then they peak, and then they come down, okay? So these are the total number of infected people. They break down into multiple kinds of people. Some people may have a severe reaction, some people have a mild reaction, and some people may have asymptomatic reaction, okay? So that's one scenario we have, which we kind of be interested in, versus what you have the plot on the right, where actually there is an exponential growth in the number of cases. So it's represented in this curve over here. and maybe another exponential growth at a different exponent, but no leveling, no apex. It's never leveled and it's not coming down. Okay, that's another scenario where the pandemic is not controlled and it's growing in an exponential rate. Again, for that pandemic, you would have severe cases, mild cases, and asymptomatic cases. Okay, one question that everybody was asking is, how bad is the situation we're in? How rapidly are the cases increasing? You know, so this was early on. We just wanted to know, what is this exponent? How many more people are getting infected every day? Well, in the general sense, the way we do this, if this was an experiment, say a controlled experiment, is that we go out in the open world, we randomly sample, say 10% of the population, okay, and we see what we are. You know, we plot this curve based on the sample. This is called random sampling, and we will talk a little bit about that in the bootcamp. It sometimes 10%, sometimes even 5% of the population is enough to give us exactly whether we are in this regime where things are under control or this regime where things are exploding. Here is the problem that people were having at that time. In March and April, we did not have random testing anywhere. I mean, in the United States, we definitely didn't have random testing. So the people that were getting tested are the self-declared people that they are sick. They're the people that had severe conditions. They went to the hospital and said, do I have COVID? Sometimes they had COVID, sometimes they have a flu. So only the population in this purple that was being tested, nobody else was being tested. So all the time we were talking, people were saying, how can you know how many people are sick? We're only testing the people that are, how many people that we know are infected. We're only finding more about the people that are severely sick. And so when we started looking at this and say, well, that's interesting. I mean, that's a tough data set to play with. But in fact, actually, it turns out something interesting you can learn. And one thing that is interesting is that you really have only the severe cases data, the people that went to the hospitals with illness. Let's make an assumption. And this is, by the way, how a lot of data science works. Let's make an assumption. And the assumption I want to make is that the people with severe reaction are a constant fraction of all the people that are infected. That is, because of their age, because of pre-existing condition, because of other things, there's a constant fraction of these people in the population. So the number of people that are severe is a constant fraction. All of a sudden, the data is very valuable. Because if it's a constant fraction, and I'm only interested in the growth rates, the actual number doesn't matter. What matters is the ratio of what happens tomorrow based what happens today. The ratio doesn't care about the absolute number. It cares about the growth. Perfect, right? And so now this data is valuable. I won't be able to estimate the total number of infected people, but I will tell you how quickly people are getting infected a day, every day, and the next day. So that's one example. And so we do a hypothesis testing thing, which we will teach, something called null hypothesis in statistics. That would be the first part of our lectures, to understand how we use the data to decide whether I'm in regime A or regime B. And that's, I would tell you, this is the first, most fundamental way of using data, is understanding the level of uncertainty and what you can learn from the data. So that's my first example. I will skip the details. We made predictions, and the predictions were fairly accurate on the growth rate, on the apex of the disease, on the decline of the disease, and so forth. Another area that you'll learn about, which is equally important, and I'm going to stop because I think Milan probably has a ton of questions for me, and you guys have a lot of questions for Milan as well, is that when you do an intervention, I mean, this is a really important question. How effective was the intervention and what matters? So here's an example. I'm going to just show you this example, right? So the lockdown, we wanted to measure the lockdown. The first thing we wanted to understand, how do we capture the lockdown in any country? Well, it turned out that, and we played around with different data sets, Google's data on mobility turned out to be the most indicative of the lockdown. So really you can measure how people are, how many businesses are shutting down, how many schools are shutting down by the percentage of reduction in the mobility in different countries. So we have here, for example, in the United States, early on, for example, we did not employ a lockdown. And what we are going to show you in this course, in the bootcamp, this is something that DevRat's going to teach, is how do you estimate the counterfactual? What do I mean by this? The counterfactual is, what if I did this? What would have happened? That's really important, right? Because what you did is, in the United States, well, we did nothing. We did nothing, right? And this is the number of deaths that we have. This is a curve of the number of deaths. But here is our prediction of what would have happened if you reduced the mobility by 10 to 40%, you would have got the orange curve. If you reduced it by more than 40%, you would have got the green curve. Okay? How do I know that this makes sense and so forth? Of course, I mean, I have to show you that there's a statistical validation to this particular approach. But here's an interesting example. So in Turkey, who applied a lockdown early on, they were in the 10 to 40%. They were in this region over here. If they didn't do that, this is the predicted number of deaths that they would have had. I'll give you the example of India, which is great. India has actually an early lockdown, and they were mimicking the green curve over here. We proved or shown that, in fact, if they did not apply that lockdown early, it would have been about 9x deaths in terms of the number of deaths in the country. It's a huge number of people would have died if this was not applied. It's very important to understand the efficacy of your strategy. This is the part of the institution. Institutions roll out policy, but they have to continue to understand how effective their policies are and so forth. So I'm going to stop here because I talked a lot. I have a lot more to tell you about what you can do with statistics, but I think the important picture that I gave you is this picture over here, this one. It's a very schematic picture, but it is about the breadth of the data. And as a data scientist, as you grow into the data scientist, I think one thing that is important to recognize is that you will never be handed the data all connected with each other. It would just never happen, And so a lot of the work that you do is collecting the correct set of data, linking it correctly, building the models that will use the different aspects of the data to make decisions. And so it's important to do this right. So I'm going to stop here and hand it back to Milind. Let me unshare my screen.
Yep. No, thank you. Thank you, Munther. This is, you're absolutely right. I think the questions coming in, people have a lot of questions. And I'm just trying to figure out how to moderate them because I'm trying to find a fine balance between going too deep and at the same time, not getting people lost in the deep technicalities. But, I really liked how Munther summarized the whole use of data science. In this case, he talked about COVID, but, what I gathered was, that chart where he showed that, look, firstly, systems are interconnected, right? So when you look at data, you got to look at various, aspects of data. There's data from, the economic systems, the systemic data, there's the social interaction data. There's, of course, in this case, the healthcare data. And being able to connect the dots between them, right? That's one. The other thing I gathered was that, look, data is always noisy. You'll never get, we all wish we were in a perfect world where we had perfect data. The reality is, looks like, let's wake up to reality. Data is always noisy, but that's exactly where Munther and his team, right? And that's exactly where I think one of the key pillars of learning data science, of learning something like the bootcamp, will be to essentially do that, which is, can you find the signals from the noise, right? And he gave some examples of how he's able to, even though that data of the people who were sick was kind of biased because it was all people who had morbidities, he was still able to, in a creative way, use that data to still figure out things like, what's the growth rate, right? And the ratios and so on. So how do you find signals from a noisy data, right? That's number two. And the second and the last one, I would say, he alluded to this idea of interventions, or rather put in more business terms, I think he used the term what if analysis, right? What if we had got everybody to wear masks? What if we had had a lockdown a month earlier? What if, right? And I feel while he's talking about COVID, I feel that applies so much to just about every industry we are in. I can for sure, I'm a product manager, right? I used to work in my past life as a product manager. And I always had questions around what if I change the price of my product? What if I package the product differently, right? The what if applies across industries, across businesses. And learning that skill of being able to predict what if, I think will be huge. And that's one of the skills I think Munther mentioned that Professor Shah, who's one of the faculty, will be talking about that. So I'm really looking forward to that. Um, but with that, let me quickly take a few questions, Munther. So there was a question it's a lot of questions from folks here. Robert was saying, look, I'm 12 years in the retail industry. Christian is saying, look, I've been in finance and I do a lot of accounting. I want to apply data science to accounting. So people are coming from different backgrounds here, not necessarily COVID, not necessarily healthcare. And I think the question, if I were to summarize it, is data science for me? How do I apply data science, to my domain? Or am I supposed to be, becoming a data scientist to solve COVID problems? So any thoughts on that, Munther, is data science for me if I'm in a certain industry?
That's a great question, Milind. And, our pre-conversation before we got into the webinar, you were asking me, how is it that I worked in so many different fields? And, I've done work in biomedical, I worked on economics, I worked in transportation. I've actually worked on control systems for the space station, I've been, around different areas. But what is important here is that data science, and by data science, I feel like there's a broad set of tools that one has to learn, right? Data science means a good foundation in probability and statistics, a good foundation understanding machine learning and prediction, the different techniques of machine learning, obviously, neural network, decision trees, non-parametric methods as well as parametric methods, right? And then finally, decision theory. How do you make decisions and how do you use the data to do that? One of my colleagues here at MIT in brain and cognitive science, long time ago, when we were launching IDSS, somebody said, you got to put in, a definition of what you mean by data science. And he's a statistician, and he said, data science is decisions under uncertainty. That's what it is. Decisions under uncertainty. And, people can disagree maybe with the definition. I found this definition to be absolutely fundamental. And now, if it's decision under uncertainty, you can look at your work and say, do I make decisions under uncertainty? If you make decisions under uncertainty, this is for you. Because, all of us, whether we are in marketing, whether we are in risk management, whether we are working on epidemiology, whether we're working on designing a control system, we are always working on decisions under uncertainty. And uncertainty is mitigated by the collection of data. Okay, so one thing is important is this is not a passive exercise. It's not like data comes and hits you in the face. You gotta go find the right data sets that you need. That's why we experiment. We experiment to find the right data sets. But I definitely think that this is a core foundation. And now, the past decade, I would say, with the increase in computation power, the ability to process data locally on your cell phone, not only on big machines and so forth, things have changed. Everything has become data-driven, I joke about with my colleagues in civil engineering, and I would say, look, civil engineering has changed. You no longer care about who builds the bridge and the highway because those are expertise exist in industry. It's all about information and how you manage the data. Congestion is about management of data. Cybersecurity is about management of data. I can't imagine a field today where data science is not at its core. So I think it's for you. But with high probability, it is for you.
No, I like that. And I also like to I like the term you use, decisions under uncertainty. And I think the key is decisions, because there's a lot of data, and absolutely, taking that data, which is noisy, and converting it into insights is absolutely necessary. But there's the other half, which is equally necessary, right, for all of us who are working in the industry, which is from those insights, can you help make a decision, right? And that's a skill that that is key to applied data science, right? Where you apply this data science and help you make that decision. Of course, nothing is 100% certain, but at least now you have some framework, which you'll get to this boot camp, where you can make those decisions, with a certain degree of confidence. Um, Another question, Manza, that folks had was, about their background. That look, what is the background that we would need to have? Maybe I can just take. So, for example, Shubham has asked about this. Santosh has also asked about. I have some background. Taken a course on, say, probability in undergrad. Maybe I've studied engineering. Or economics or some field like that. So I have that background, and now, do I need anything else? So I'll let Manza comment, but one thing I can tell you is that what we are looking for is some, a basic knowledge of, working knowledge of statistics and probability, and a basic knowledge of programming. And one of the things you also do is, if you enroll sooner for this boot camp, we make these modules available so you can start getting up to speed, so that when the professors start teaching it, which they will be also covering the necessary parts of probability statistics when they teach. But when they start teaching it, you'll also already have a head start on it. But with that, Manza, do you have anything to add around what's the background that I need to basically become a data scientist?
That's a great question, and I'm glad that you guys are providing the support early on and so forth. Look, I mean, there is no perfect answer to this. Data science can go from a level of just applying it through sort of blind application of libraries, all the way into the in-depth understanding of the details of data science. There's never a time to say, oh, don't start, because this is a critical change in our ecosystem. I tell my children, I got 3 kids, 2 of them are in the working place, and when they were in college, I was saying, you have to get 2 things right. One is you have to know how to program, and the second thing is you need to understand data science at a fundamental level. Why program? It's not because I think programming is so essential, but it is a barrier you just want to get rid of. If people that look at programming and they say, I don't know how to program, they feel it's a huge barrier. They can't get over it, and it stops them from expanding their careers. And so take a programming course and get rid of that problem. It's not that hard, and there's always a way to do it, So I feel like you just can't wait for the perfect moment to start. For some of you, the bootcamp may actually seem a little tractable, maybe easier because you've taken more courses and you know more. For some of you, the bootcamp may appear to be harder and you need more preparation. The whole point of it is that there's going to be homework and a team and TAs that's supporting the courses that you're going to learn. And if you don't learn enough, maybe then you sort of find another place where you can get more in-depth material in there. But I'm just saying there's no perfect answer to that. I like the idea of having some basic, basic preparation in probability and statistics, and a little bit of programming, and understand, an undergraduate degree would be more than sufficient, I think, for the bootcamp.
Got it. No, that's fantastic, Professor. And just to add to that, that's something that we at Great Learning, who are collaborating with the IDSS faculty, are providing that support around everything that the faculty is teaching. Including what Munther alluded to, which is you would need to to bring to life all the concepts they are teaching. Our plan is to have you bring that to life using Python, right? Now, we don't want you to be Python experts. That's not the point of this boot camp. The point of this boot camp is to get your foundations right through the faculty, and then know what's the bare minimum that you need from these Python libraries to bring it to life, to put it into, to apply those concepts, right? And the same goes for statistics. The point is not that we need you to be, we want to train you to be a statistician, a PhD in statistics, although, I'm sure that would be nice. But the point is, you should have enough of that foundation to be able to interpret the results, right, that you get. Look at the data. Munther showed these. One was a logarithmic chart, one was a linear chart, right? Being able to tell the difference, right, and being able to understand, what's the mean, what's the variation in the data, and so on. And for that, you need that basic level of knowledge, which you can, which we will help you bring you up to speed on. Using a variety of methods, such as our personalized mentorship, where we have our industry experts who at the end of every lecture from the professor, will be having these mentorship sessions, right, where you will have that kind of personalized feedback from your mentor as you work through the problems, right? And that's what really we believe will help you internalize everything that Munther and his team are teaching, right? So you will learn from them, but then we apply it together in these mentorship sessions, and then we assess it, right? Your mentor will help you assess it. So this idea of, learn, then apply, then assess, and then again learn, then apply, then assess. And we do that week after week. And that's, what we feel, what we've seen is the best way for us to, become that hands-on data scientist. And another question was, folks had questions around the boot camp. Gokul had a question around, and I think so did Gautam, that look, after this boot camp, will we be equipped with the knowledge and the tools to start working on data science problems? And I think a related question was, what are the other projects? What are the other problems that we can get exposed to, through this boot camp? Besides, of course, the COVID-related one. Again, I think Munther in his lectures, especially around decision trees and time series and so on, he's identified certain problems that he's going to be talking about. So have the other faculty, by the way. What I do know is that they will be introducing various, kind of real life use cases, some real life applications. And we will be also in our mentorship sessions working on those kinds of projects, right? Projects applied to the industry across various industries. We have a project identified in the insurance industry, in the banking industry, in healthcare, in retail. And I think the professor is also going to be talking about, I think Professor Yegelka is going to be talking about an application in computer vision. Professor Shah is going to be talking about an application of, recommendation system, but applied to the music industry, right? Munther, do you have anything to comment there around what kind of projects people will get exposed to?
I think that, honestly, I think our intention is that what we teach would be applicable to any project, and there will be no specifics to this. This is only works for finance, and this works for insurance, and this is for healthcare, because it's generic. It's about the data. Here's how you process the data. The details, obviously, of every problem matters. But right now, what we want to do is understand these tools and what they mean. And so deliberately, actually, the five of us that are involved in the class, we first talked about, should we coordinate our examples? And then we decided we're not going to coordinate our examples. And the reason we don't want to coordinate our examples is that we want our examples to come from anywhere, And so, Delrat has examples from music. Maybe Caroline will have examples from healthcare. Stephanie can have an example from image processing. It's fine, right? Because this is the intention here is to learn these tools. You will have an opportunity to apply these tools, of course, in the projects that Great Learning is going to provide you. That's fantastic. But ultimately, you're going to have the opportunity to apply it at your work. And we also offer separately, a MicroMasters in data science at MIT. This is a certificate. This is a degree, essentially, at MIT. And it's a graduate level degree. And I've been in contact with a lot of the students that we teach. And yes, granted, that's more sophisticated and it's more for people who are intending to do more research in this area. But once they're done, it's amazing the transformation in the way they think about the problems they were working on before. You know, I had an example of people that were telling me, I've been doing logistic regressions for many years. I know a lot about logistic regression. You know, I know that in the car insurance companies and so forth. I want to learn something new. And at the end of the meeting, he goes, I think I never really understood logistic regression. I'm so glad that we did it in the course. You know, I've been using it, but I didn't understand it, you know? And so now I understand what I was doing. I'm going to do it a little bit better. And so I feel like this is what we're focusing on, not so much the domains, but the methodology and the techniques and how you interpret them. As Milan said, it's very important to know how to interpret your results. When you look at a result and it doesn't make sense, you should be able to figure out why it doesn't make sense. And, you know, I mean, people, honestly, I can't tell you enough stories about this. Articles and people publish statistical information that is utterly flawed. You know, so many mistakes are being done, and as a result, so much people are impacted by that is not true and not correct, and the data never said that. You know, not because they're trying to obfuscate, but rather because they don't know what they're doing. And we want to just get to the point of that everybody understand what they're doing. So I think it's going to be much broader than a specific project.
Yep. No, I thanks for reminding us that, Professor, which is that, look, you know, we will be covering a wide range of examples, but that's not to say that that's what we want you to be an expert on. Quite the contrary, what we want you to be very, you know, an expert, very comfortable with is in your industry, in your domain, being able to think of, you know, how you can translate that to the problems that you see on a daily basis. And, you know, I can't agree any more with, you know, Professor Munther, sorry, agree any less with Professor Munther on what he's saying about, you know, what he's seeing from students around, you know, simple things like, say, log regression, right? We all think, oh, you know, I get it. This is logarithmic regression. But, you know, we'd be surprised at how, you know, these very foundational concepts, if we get those right, you know, those by itself are so powerful for us to apply, you know, at our work. And that's exactly what the hope is, the plan is as an outcome of this boot camp, which is you get comfortable with that foundations, you get comfortable with being able to apply it to real life problems, you know, across different industries, so that when you graduate from this program, you have that, you know, that confidence to say, all right, if there's a problem, I know what are the questions I need to ask, what's the kind of data I need to get, and how to apply it. And lastly, you know, how to interpret that and make decisions out of it. You know, we are just short of time. I just wanted to cover there were a few questions which are more logistic in nature, like, you know, well, can you tell me more about the mentorship? Is it one-on-one? You know, how is it conducted? What is the fee structure? So I just wanted to cover that real quick in the short time we have. So the lectures, you know, I think Chandrasekhar had a question on the fees, how the classes are structured. William had a question on, you know, the mentorship. So the lectures are live by the professors. So there'll be these 5 weeks where, you know, Monday, Wednesday, Friday, you know, 2 hours each. We will have lectures taught by the faculty. Common questions come up. Well, what if, you know, there's an occasional meeting and I had to miss this lecture? Well, no problem. It's all recorded. So you can always, at any point, go back, see it any number of times. Right. So everything is recorded. You'll be able to watch it again if you can't attend the live one. In addition, there's the mentorship, which is at every weekend. And this is across, you know, the entire duration of those 12 weeks. Every weekend you have your sessions with your mentor and your cohort. So you'll be teamed up with a cohort of about 10 to 15 other students, you know, who come from diverse backgrounds. And that's, by the way, by intent. We want people from very different backgrounds to be in this cohort team who will bring ideas from their industry. And the mentor will go over what was taught, you know, by the faculty. And this time it will be more a session of, let's talk about how to apply that in your work, how to apply that in industry, how to make, you know, bring it to life through projects, right? So we'll have these mentor sessions, this learn, apply, assess model. You know, a common question that comes up is, well, you know, I may not have, what if I may not have the time, right? What if I'm falling behind? So this, first of all, this program is designed for working professionals. So we understand you all have a day job, right? So the idea is that it's structured to work with that. It's also spread out. We also have these, we deliberately have introduced these gap weeks in between. So for example, there's, Thanksgiving the whole week, it's for you to just catch up if you're falling behind. The 2 weeks of Christmas, again, for you to catch up. There's a week in the middle, again, for you to catch up, where our mentors are there on standby if you need any help. And the idea is that, beginning January, you have 3 weeks to work on a capstone project, right? Where at the end of it, you will present it, and you'll also have at the end of it a portfolio of all your projects. So it's designed, in short, it's designed for you as a working professional. So we just want to make sure that people understand that. And the last question was the fee structure, right? I think Yu Hong also brought this up. So it is $2,600. Having said that, this, if you register before the end of September, there's a discounted fee of $2,500. Yeah, and let us know. Yeah, I think they also have ways to, if you'd like to pay it in installments, we can help with that as well. But that's the fee structure of the program. Somebody had a question on program manager support. So we have a program manager assigned to each of you. So, any questions around the logistics, getting access to the system, if you have doubts, if you have any queries, if you're falling behind, you need some time to catch up, that's what they are there for. So they are there to make sure that each one of us, gets that knowledge, understand the foundations, understand how to apply it, build a portfolio of projects, and essentially get us to the finish line. Yeah, so that's what the whole team is there set up around you for that. With that, there are more questions, Professor. Around how do we remove bias from this data, and how did you do it with the COVID data and so on. But I wish we had more of Munther's time. But here's what we can do. If any of you have any questions, please, by the way, there's a link on your chat. Please click on it. It will send you to our bootcamp site, where you can get in more information about everything we said. And also, if you have any questions, you can always email us, right? So you can email us at programs. Sorry, here you have it. Programs or adsb.mit@migratelearning.com. Or you can also go to our click on the link on the chat session. If you have any questions, we can compile it, and the ones that are for the professor, we can also compile it for the professor. We have our own industry experts as well who can also help with that. And lastly, that's exactly the reason why we wanted to bring this boot camp to life, which was to get these very concepts that you just heard from Professor Munther. Just this idea, right? Everything about how to bring all these disparate data together and how to make sense of it, how to get the signals from the noise. And then lastly, how to take that data from insights to this what if analysis, and lastly, to make decisions, right? Which is what matters at the end of the day. That's exactly what you will learn. And this was just a preview of that. So I hope you all enjoyed it. I want to thank you again, Munther. I can't tell you how thankful I am, because there were so many questions, and I think I definitely learned, and more than learned, I think I definitely got inspired by everything that you showed us. So thanks so much, and I look forward to the bootcamp.
Thank you. Good to see you.
Yeah. Thank you.
Thanks.